Thank you for being here. Thank you. Welcome. Come on, a little bit louder. Welcome. Well, now you can talk. Well, you can respond. MS Views and News delivers live educational programs all around the country. We've covered 25 states in the past year, and we intend to cover another 25 this year. We did over 50 programs last year, as well as we will this year. We look to empower and engage those impacted with multiple sclerosis. That's why you guys are here, right? We provide over 50 educational programs, as I said, and you can find them on YouTube because most of them are video recorded. If you go to the YouTube channel, MS Views and News, Learning Channel, and click on it, you'll be able to find all the programs, and you can actually go to the top and go to the search and search through them and look at different topics, different speakers. You can find me on those. I won't be standing in front of a podium because I refrain from keeping a podium between me and the crowd. That way it can be more active. We could not do this important work without the charitable support from pharmaceutical friends and supporters like you. I don't want tonight to be the end of your MS learning journey with MS Views and News, so by going to the MS Neuro TV button when you're on the MS Views and News website, which is msvn.org, you click on the button, and throughout the year there's going to be 12 months of free live monthly webinars to learn from and enjoy in the comfort of your own home. So once you get on there, you can see on the website, there's going to be a lot of information. You click on the YouTube Learning Channel, and that'll take you to YouTube directly. And from that point, you can navigate throughout it. But once you click on it, you're now subscribed. We want you to keep learning as your own, for your own knowledge, as a community, and to connect with others, and we want you to stay engaged. Thanks to our sponsors tonight, which are MS Views and News, and the man in the back in the purple, Stuart, is the one who has founded MS Views and News, and if it was not for Stuart, as well as the people sitting here, this program would not be possible. So I would like everybody to say thank you to Stuart. So tonight's program is a balanced series. It's an educational experience addressing the many aspects of living well with multiple sclerosis. That's why you guys are here tonight. And our first speaker, I can call a friend of mine. Don't ask her because I might be wrong, but I think we're friends, right? We're going to start a band together. We're looking for names too. Well, Megan, as most of you know who she is already, so I'm going to be underselling her because you guys know what a wonderful person she is and a great presenter. She's a doctor of nursing practice, and she's a nurse practitioner at Baptist Neurology. Her degree and... Not friends now? Okay. When we were friends in the past, she's with Integrative Medicine and Multiple Sclerosis. Is that better? And she's the founder of MS Yoga. You guys with me? Thank you. So I want to introduce Megan as she comes running up here and tackles me for the things I messed up with her introduction. But she is much more than what I can open with. So here's Megan. I'm passing the mic to her. Take this. Take that from me.
Whoa, Jeff is tall. So Jeff and I are doing some programs together this year, and we decided that, since we're going on tour, we might as well have a band. Tonight, I have the pleasure of talking to you about, in greater detail, about really what's on my heart for helping people heal, and that is integrative medicine, health and wellness, and how you can incorporate that into your treatment plan for living with MS. And I get to talk about it in a bit of a more detailed way than I usually do. So I hope that you find the information helpful. We're going to define some terms because a lot of things float around on the internet about different types of holistic care. So we'll define some terms so that you guys, have some firm footing in what we're talking about and what it is that I do versus what other people may do. We're going to talk about some MS basics and also some other conditions that are found pretty frequently in multiple sclerosis. And then we'll talk about how MS symptoms are managed in traditional medical care versus integrative medical care, and outline the components of a holistic treatment plan for you as a person living with MS. So this is one of my favorite quotes ever, and it's probably one of the first things that I read in my integrative medicine training, and that is, to find health should be the object of the doctor. Anyone can find disease. And so what we're looking for is, in this soup of you, a person living with MS, or a person loving someone who lives with MS, how can you find the best way to not make MS the headline of everything that's going on in your life? Because there's much more to you than multiple sclerosis. So health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So how many of you, just first thing that comes in your mind, to your mind, how many of you would describe yourselves as healthy in this room? All right, that's not bad, about a quarter of the room. And maybe if you could just yell out why you think you're not healthy. Pain, 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 fatigue, fatigue. Okay, so those are maybe symptoms of something else that's going on, right? So wellness is the optimal state of health of individuals and groups. There are two focal concerns, and one is realizing your fullest potential as an individual in many ways: physically, psychologically, socially, spiritually, economically, and functionally. And the other is fulfilling your expectations of the roles that you have in your community. And I think that's a big driver in multiple sclerosis, because often we become socially isolated because we can't do the things that we used to do, or we can't do the things we used to do like we used to do them, so we just stop. And so what comes to my mind there is like exercise, or going out with friends, or going on outings with family. Integrative medicine is what I am specializing in from a neurological and MS standpoint. This is my second most favorite quote. It is much more important to know what sort of patient has a disease than what sort of disease a patient has. A case that I can talk to you about that might explain this quote a little bit better. When I was in nursing school, like getting my bachelor's degree, there was a physical therapist at the University of Florida in Gainesville who had no legs and was in a wheelchair. I have no idea what happened to her. I don't know what her story was. We never had a conversation. But I remember watching her work with patients, and I remember thinking that if something devastating ever happened to me, in a medical way, that I would only pray that I could have her resilience. So what is it about a person like her who overcame, a major challenge, and maybe she was born that way, I don't know, versus a person who maybe has something much more minor happen and then can no longer function? What is it that makes that such a continuum on an individual basis? So according to the Institute of Medicine, integrative medicine includes a broad definition of health, a wide range of interventions, coordination of care, patient-centered care, and a variety of modalities. I will read you these definitions because they're small. According to the center where I trained at the University of Arizona, integrative medicine is a healing-oriented medicine. It takes into account the whole person, including all aspects of lifestyle. It emphasizes the therapeutic relationship between the practitioner and the patient, and it is informed by evidence and makes use of all appropriate therapies, which means traditional medicine and complementary and alternative medicine. In addition to the above, and I think perhaps the most important thing, is offering a person the least invasive, least toxic, and least costly methods to facilitate their health. And these are recommended based on an understanding of your whole entire being. So not just your physical exam, but also the way you feel about what's going on with you, your spiritual aspects. And it maintains that healing is always possible even when curing is not. And I think that is the tenet of the way that I hope to practice, because I think that we are all capable of healing, even if we still looked at our insurance, EOB that comes in the mail and saw that we still had diabetes, or we still had breast cancer, or we still had MS. I think that we can all feel that we are healed. Complementary and alternative medicine is different. So you guys have probably heard the term complementary and alternative medicine. Complementary medicine is using a non-mainstream practice with traditional medicine. So like me, every year I see my primary care doctor and I see my OBGYN, and monthly I go to the acupuncturist. So I practice complementary medicine. Alternative medicine is using a non-mainstream practice instead of conventional medicine. So that would be a person who is living with a medical condition and not using a regular medical doctor or doctor of osteopathy, but maybe seeing an energy healer instead. So that's how the world would define these things. The top 10 most common complementary and alternative medical therapies in 2012, which is the most recent survey, include natural products such as supplements, which I'm sure you can all understand because of infomercials and Facebook and your neighbor who's selling X, Y, or Z. Deep breathing, yoga, Tai Chi, and Qigong, which are long-standing ancient traditions. Chiropractic and osteopathic care, meditation, massage, special diets, homeopathy, progressive relaxation, guided imagery. So the second most common type of complementary and alternative medicine is deep breathing. Is that harmful? Is it costly? Is it invasive? How many of you know how to breathe deeply? Maybe like 8 of you in this room, right? So these are, even though these things may be innate, they're things that you might need to be taught. About 30 to 80% of people living with MS use complementary and alternative therapies. They're more likely to be women with higher levels of education, and they report poorer health, which means they're looking for other things to help them get better. 90% of them also use conventional medicine. Many people who live with MS choose not to tell their use of complementary and alternative medicine to their regular medical providers. And that's probably the most dangerous thing, is that most of these things are harmless, but some of them can be harmful depending on what medication you're taking and what other medical conditions you may have. So it's really important to tell your provider what you're doing, no matter what it is. This is a little algorithm that I think I've presented to some of you before at other meetings, and that is, well, how do I know whether something's useful and safe? And so I say, well, is there evidence that what you want to do is helpful for an MS symptom? If yes, then we go on. Does that evidence outweigh the risks? And that risk includes financial harm as well, because some of these things are very expensive and there's no evidence that they help. If yes, then we can go to question 3. If yes, then we can recommend it. If no, then we go to question 3. If there's no evidence and you want to try it anyway, is it harmful or costly? If it's harmful or costly, you stop. And then you talk about other things that you might be able to recommend. If it's not harmful or costly, then maybe you decide to try something. If you have realistic expectations about it, keeping in mind that many of the things that are purported to be beneficial for your overall health, your neurological health, for your multiple sclerosis, have not been studied in large populations with large numbers of people in a way that's very scientific as far as science defines it. So let's talk about MS. More than 1 million people in this country have MS. And you might say, wait a minute, the last meeting I went to said 400,000. Well, we all knew that was a very old statistic and most likely inaccurate. 3 to 4 women to 1 man have multiple sclerosis. And just looking around this room and knowing the people in this room, I can see that ratio is about correct. It's more prevalent in Caucasians and in people of Northern European ancestry. It's more severe in African Americans and in men. And there is an association between an increased risk of MS and worse MS in people who smoke and in people who have a low vitamin D level. How many of you, maybe at the time of your diagnosis, had a fleeting thought that if you got multiple sclerosis, you couldn't possibly get anything else? That's good. That's good. How many of you have ever thought, well, since I have multiple sclerosis and I see my neurologist so often, I don't have to go to the doctor, like the primary care doctor? You guys are so well educated, except for a couple of you. And I wouldn't say that's a lack of education. So the most common other problems that happen in people living with MS are anxiety, high blood pressure, high cholesterol, and chronic lung disease for whatever reason. The most common autoimmune conditions that also happen in people living with MS are thyroid disease and psoriasis. And these occur much more commonly than previously thought. Stroke, heart disease, congestive heart failure, irritable bowel or inflammatory bowel disease, seizures, sleep disorder, bipolar disease, and alcoholism. So why am I talking about these other things? Well, I'm talking about them for a number of reasons. One is that all of those other things I mentioned can also be harmful to your nervous system, which in turn means that your reserve and your ability to keep up with your MS and face it every day is a little bit lower. Integrative medicine and the tools that we use don't just treat your multiple sclerosis. They treat your entire person. So if you're practicing or seeking care with an integrative medicine provider, you're going to find that if your MS symptoms feel better, your diabetes numbers may improve, your cholesterol may go down, your blood pressure may go down. And that's because the treatments are meant to treat you as a whole person, not just as I have MS and I'm tired. Your body has an innate capacity to heal itself, and that's what we're trying to find for you, get you on that road again. So an example would be feeding your body healthful foods doesn't just help with your blood sugar, it also helps reduce your risk of heart disease. It also helps reduce your risk of dementia. It may improve your energy level, and it may actually improve pain if it's from inflammatory conditions. So I like this picture because it's a nice hug. Integrative medicine is kind of like a nice warm hug to me. Comorbidities can worsen MS. So a vascular comorbidity, which means I'm a person living with MS and I have high blood pressure, diabetes, high cholesterol, obesity, or I've had a stroke or I have heart disease, occurring at any time in your life increases your risk of disability progression to a point where you need to use an assistive device all the time by approximately 6 years. So that's why it's so important to consider all of these other things when you're learning about treating your MS. There's also very little data for the use of integrative therapies and complementary and alternative therapies in multiple sclerosis. And I see some heads nodding because I know those of you who are active in this world. and have had results from it and believe in it. And I know that you know the challenges. But there are larger studies for some of these other conditions that are much more common, like diabetes and heart disease. Also, talking about this provides me and your other healthcare providers with an opportunity for education, particularly preventive education about how to keep yourself healthy. And ultimately, if you're keeping your body healthy, you're keeping your brain healthy. So what are the challenges of integrative medicine in MS? Well, there's not a lot of evidence. So me talking about this right now, actually in the back of my head, I'm thinking about some of my physician and PA and nurse practitioner colleagues watching this and saying, she's crazy. That's voodoo medicine. This is a gray area. So that's what we're faced with, on a daily basis when someone like me discusses this type of approach. It's easy to get bogged down in the details. And for those of you who are active in the world of integrative medicine, functional medicine, complementary and alternative medicine, and following people on YouTube and Instagram and Facebook, you can really get bogged down in all these lab tests that you can do, to find out if I have this genetic polymorphism and how I metabolize this and what micronutrient am I deficient in? But the bottom line is most of what we do is treatable without those things. There are also perceived side effects and drug interactions from herbs and botanicals, not just perceived, but also real. The biggest one being warfarin, which seems to interact with most herbs and botanical therapies. But then in larger studies for some things, it does okay. But we have to be mindful of using things that are not pharmacological agents because they can have drug interactions that are very serious. We also have to think about the quality of intervention. Are you seeing a reputable provider for acupuncture or chiropractic care? Are your sources of supplements safe? Have they been adulterated, which means they have other things in them that you don't know they have? Are they the same every time you get them? So, and then how do they affect the other medications that you take? So those are the challenges of this type of practice. So how would I use this in multiple sclerosis? Well, what it is careful examination of the available evidence for complementary and alternative medical therapy applied in an integrative setting to provide the best care to you. What it is not is piling a bag of supplements onto your already large bag of medications when there's no evidence for any benefit. It's not telling you to follow a fad diet with elimination of healthy food groups if that's not necessary. And it's not throwing caution to the wind because of one YouTube video or blog post that you or your cousin's husband saw on TV. So I think that's really important to understand that there is a difference between doing something in a complementary way or an alternative way and being managed by a person who's trained in the science behind it. The basics of multiple sclerosis, you guys could stand up here and give this talk, but I think it's worth mentioning that the newer descriptions of MS are changing the way that we talk about MS. And you may even have heard that at your last visit to your MS doctor. We talk about MS now as relapsing and progressive and active or not active. And still the most common type is relapsing MS. Active disease means your MRI is active or you're having relapses or your disease is progressing. Not active means none of those things are happening. Disease-modifying therapies for relapsing MS, there are 13 plus several pending this year. For primary progressive, there's now one plus several at the end of their research endpoints. Secondary progressive is very likely to have a pending treatment this year. We manage MS relapses with steroids, oral steroids, IV steroids, ACTH, gel, plasma exchange, IVIG. And then we talk about symptoms. Symptoms for MS can be primary, which means they come directly as a result of a lesion in your brain or your optic nerve or your spinal cord. So an example of a primary symptom would be optic neuritis, which is due to an inflammation in your optic nerve. Secondary symptoms would be a symptom that comes from something else. For example, you have fatigue, and your fatigue is worse because you just started taking a muscle relaxer to help your spasticity. So that muscle relaxer is enhancing your fatigue, so to speak. Another example of a secondary symptom would be falling. And you're falling because you have weakness in your legs, or maybe you have sensory loss or balance loss. And then a tertiary symptom is one that is more psychological or behavioral or emotional. And so that might be depression because you can no longer work. Now, depression can also be from lesions in the brain, so it could be primary. It can also be caused by medication, so it could be secondary. But this is how we tend to talk about MS symptoms. Symptom management, to be really comprehensively and effectively done, requires a multidisciplinary team. It may require pharmacologic agents, it may require rehab, and it may require integrative medicine or CAM, complementary and alternative medicine. How many of you have seen this slide somewhere? At a meeting, in a book, in a journal, something. So I'd like to give full credit to my colleague and friend, Dr. Stephen Krieger at Mount Sinai, for coming up with this idea. I think it's a wonderful idea. You have this pool, and when you see I'm just going to call them icebergs. When you see the icebergs break through the water, that's when they're showing up in your body. So the iceberg may be a relapse, or it may be symptoms getting worse. And if you look at the water level, as that water level were to lower, more of those icebergs would show up above water, right? So you can think of that water level as your reserve. So literally, if you're dehydrated, your reserve goes down. If you're sick, your reserve goes down. If you are really run down and stressed out, your reserve goes down. If you are being treated for other medical conditions, your reserve may go down. So it's really important to keep that water level up. Disease modification, what I'm going to do is talk about components of MS, and we're going to compare what we do in allopathic medicine, which is traditional medicine, versus what we do in integrative medicine. And by we, I mean healthcare providers like MDs, DOs, nurse practitioners, PAs, who are trained to evaluate a person and diagnose and treat their condition. So for disease modification, we have very high level of evidence for treating relapses with steroids and ACTH. We have very high levels of evidence for treating relapsing MS with disease-modifying therapies, and also with one therapy for primary progressive MS. So we have these double-blind, placebo-controlled studies that are duplicated and produce the same results, and they're done in an amount of time that's considered to be significant. For integrative medicine, there is no high-level evidence that the things that we do or tell you to do, like diet, exercise, mindfulness, supplements, botanicals, alternative treatments, manual therapies, actually modify your disease. For example, prevent MRI changes, prevent disability, prevent relapses. Now, because I see the heads nodding, saying, no, I know these things, they work, they help me, and they do. I'm just saying there's no high levels of evidence. There aren't 3,000 people in a double-blind, placebo-controlled trial. And knowing what I know after 18 years of treating people with MS, there are very few reasons why I would not recommend a disease-modifying therapy to a person. There are smaller studies for integrative medicine modalities that suggest improvement in symptoms. changes on MRI, and speed of disability progression. And I'll talk to you about those as we move on here. So if you can take home anything today, and I hope someone's monitoring my time, and maybe Stu's going to yell at me when I have like 15 minutes. Yes, all right. So if you can take home anything today, I want you to take home these 3.5 things, and there's only 3 on there, but I'm going to add a half. The single greatest thing you can do for yourself is to start eating healthfully. You have absolute control over what you put in your mouth. And you can't tell me otherwise. You have absolute control over what you put in your mouth. The second greatest things are mindfulness and exercise. The reason I don't give them as much strength as nutrition is because your mind can really get in the way of you being mindful and exercising. So it's a practice. So you can't always control your mind at first. So you might kind of give up on that, right? Or exercise, moving your body, not running a marathon, not necessarily doing the MS 150, but just moving your body in some way. And again, your mind can get in the way. So the biggest problem that I see is this example, and I hope some of the guys in here laugh at this, but I'm 43, my dad's 70, almost 71. My father, God, I hope he never watches the YouTube channel because he'll kill me, and I love him to death, but this man still believes that it doesn't count if he can't do his high school football workout. So, you know, and I meet many men who are my age, who are younger, who are older, who have MS, who don't have MS, who have other things that don't believe exercise counts unless they can still do it the way they did it in high school. And so I'm just here to tell you that that's not true, that moving your body counts, that the things that you used to be able to do, you may not be able to do, and they may look different. I've experienced that in my own body, with my own schedule, since the birth of my son. And that's just how it is. And I was one of those people who didn't believe it counted unless it was 90 minutes a day and I was about to pass out when it was done. So, you know, a lot of you know me very well, and that's true, and it is no longer. So these are the 3 single greatest things that you can take home from this message. The other one is sleep. Sleep is so important. Sleep improves your insulin resistance. Sleep improves your ability to think. Sleep improves your mood. If you are not restfully sleeping, please talk to your healthcare provider about it. So let's just start with nutrition because it's safe and you can control it. Really old quote here, this guy Hippocrates, he's been around for a while, right? Let food be thy medicine and medicine be thy food. That oath that physicians take was named after him. So this is just some information. You don't need to read it. I'm going to run through it really fast. These are the diets that have been studied in MS. The paleo diet, which is emphasizes consumption of game meats, and then a lot of green vegetables, sulfur vegetables, fruits, and a high intake of polyunsaturated fatty acids. The Paleolithic diet is similar to the Wahls protocol, but the Wahls protocol takes it a few steps further. So, oh, somebody didn't silence the phone. So, in people living with MS, a single study showed improvement in cardiovascular risk factors with the Paleolithic diet. And this study did not have a comparison group, and they were looking also at improvement in fatigue, and there was possible improvement in fatigue. The Mediterranean diet, which we talk a lot about because it's more varied than the paleo diet, high intake of omega-3 fatty acids and fish and olive oil. There was, in this diet, there were no evidence in benefit in MS, but there was evidence for benefit of cardiovascular health, diabetes, and potentially cancer risk. The McDougall diet, which is a high carbohydrate, low fat vegan diet, did not show evidence for benefit in MS, but one study showed improvement in cardiovascular risk factors. Gluten-free diet, again, no evidence, but it benefits people, no evidence in MS, but it benefits people with celiac and non-celiac gluten sensitivity. And then the swank diet, which is the oldest available or the oldest respected, quote, MS diet, a very low-fat diet that eliminates poultry and the increased intake of omega-3 fatty acids. An observational study of a small cohort of people suggested improvements in relapses and functional status, but it wasn't a high-level study, and there were no other benefits noted. So other things to consider when you're looking at a nutritional plan are the Gold Coast Cure, which is like a modified swank diet. They allow poultry. It is gluten-free. The Walls Protocol, which I think is the most popular these days because Terry Walls is an MD physician who has MS and who had incredible results from developing and following this protocol for herself. The benefit comes from the amount of vegetables, 9 cups of vegetables per day, and there are very specific types of vegetables that you need to eat, as well as the types of meat that are in the diet. And so following this diet doesn't mean that you can go to the grocery store and get the ground beef that's on sale. It just doesn't. Honestly, if that's what you are thinking about doing, just don't do that, because you really have to eat high quality food. The anti-inflammatory diet, which Dr. Andrew Weigel supports, is a Mediterranean diet I call it with an Asian spin. So he believes a lot in the health benefits of certain types of edible mushrooms that you cook with, not the kind that, you all giggle, so you know what I'm talking about, not those kind. Rices and fish. So there's a little bit of an Asian flair. And then intermittent fasting seems to be big on the internet right now and on social media. How many of you have heard of intermittent fasting? Yeah, so most people have. So intermittent fasting, actually, there's some preliminary data that suggests it helps your body to work better. So it helps your body with energy production, which in turn allows your body a little bit of a rest. And there is good data for 13-hour fast and certain types of cancer prevention. So a 13-hour fast means we eat dinner right now, which is like 6:15. You're done at 7. You can't eat anything again until 8 in the morning. You can drink water. The other type of fast that's really popular and suggestive that it might do the same things for energy production is the 5-2, which means 5 days a week you eat a fairly healthful diet, 2 days a week you fast to only 500 calories a day. And again, there's not high levels of evidence that these things modify MS. There's not any evidence that they do anything for MS, actually, at this point. However, people who follow them with and without MS will say they have more energy or they feel better. I would not recommend doing either of these types or any of these types of diets without consulting your medical provider, because if you have other medical conditions, they could be harmful for you. So you really need to talk to someone about these before you do them. The jury's a little bit out on sodium. There was this large study that came out that said if you eat higher levels of sodium, you're going to have worse MS. And then another study came out and said, no, that's not true. And then another study came out and said, yes, that is. So I wouldn't freak out about sodium right now, except from a cardiovascular standpoint. Notes about fish oil. Studies have been really mixed on fish oil and MS, but at the end of the day, probably supplementing with fish oil is not going to modify your disease. 10 minutes? Oh, goodness. And then from a cardiovascular standpoint, eating it is probably the best thing to do. News, yummy on nutrition. High quality diets, associated with a lower level of disability. That's preliminary research released this fall. High intake of monounsaturated fatty acids like olive oil, higher intake associated with increased cortical thickness. That means a bigger brain. Preliminary evidence. The modified ketogenic diet in people with MS improved fatigue, depression, and insulin sensitivity. Modified Mediterranean diet improved fatigue. People felt better and healthier. These are small groups of people, preliminary research at major academic MS centers. Medical marijuana, because I know you're going to ask. In the state of Florida, MS is a qualifying condition for low THC cannabis and medical marijuana. I know this is on YouTube and people in Iowa are watching it. I have no idea what's legal in your state. That's my disclaimer. It's still illegal by federal law. The American Academy of Neurology has published really great guidelines on the available evidence for medical marijuana and certain symptoms in MS. And there is some evidence for spasticity, central pain, and the weakest evidence is for bladder function. What about CBD oil? The best thing I saw on Instagram last week was I had 99 problems and CBD solved 86 of them or something like that. So there's actually there have been no clinical trials with CBD oil in humans. So CBD oil is the stuff you can buy at the health food store without a prescription. In vitro studies and some animal studies suggest there's a potential for therapeutic use for things that run the gamut: anxiety, pain, fatigue. I would say those are probably the most common things that people want to try these for. Sleep. But like any supplement that you buy at the health food store, you have to be concerned about quality. And a lot of these blends that people are asking me about are really super expensive. And you also have to keep in mind that even though it's hemp oil and it's not supposed to have psychoactive properties, it could. And it could interact with your medications and it could cause psychotropic side effects. So this will be, unfortunately, I have 8 minutes now probably. But we're just going to look at the difference and the overlap of major MS symptoms and traditional medicine and integrative medicine. So in traditional medicine, for motor, balance, and sensory symptoms, including pain, we use drugs, we use rehab, we use assistive devices. In integrative medicine, we might recommend massage or chiropractic care. We might recommend yoga, tai chi, or Pilates, and so might your traditional medical provider. We might recommend acupuncture. For pain, we might suggest or provide cognitive behavioral therapy, mindfulness-based stress reduction, biofeedback, autogenic training, hypnosis. We might suggest you try aromatherapy or topical essential oils. We might suggest dietary changes that can be helpful for pain. For fatigue, for both integrative and traditional medicine, we do a comprehensive laboratory and sleep evaluation. We talk to you about your mental health because sometimes people feel when their mental health is suffering that they explain it that they're tired. In integrative medicine, we also would do a very detailed nutritional evaluation. In traditional medicine, we would prescribe supplements, perhaps a PT or an OT evaluation. Prescribe medication and perhaps a PT and OT evaluation. In integrative medicine, we would talk about supplements and botanicals if we thought they were safe. We would talk about mindfulness training because there is evidence for this in fatigue, and also aromatherapy and essential oils. For bladder, bowel, and sexual function, traditional medicine would use medication. Also, nurses would tell you to change your diet, like cut back on caffeine and alcohol and increase your water, right? Some of you have heard me say that. Botox, bladder stimulators, TENS therapy, and physical therapy can help with these symptoms. In integrative medicine, again, we would start with the gut. We would start with a nutritional evaluation. If safe and necessary, we might recommend some botanicals that can be as helpful as pharmacologic therapy. We would recommend exercise. For example, there is data for bladder function improvement and yoga in multiple sclerosis. Water is our greatest prescription, and it's cheap. And there's also some data for mindfulness-based stress reduction and bladder function. For cognition, Again, see the overlap there, lab evaluation, sleep evaluation, to rule out other causes of these problems. Because as an integrative healthcare provider, I'm looking at you from both perspectives. But I would also bring in that nutritional evaluation. I might recommend things to take away. I might recommend things to add. And then we would talk for a really long time about prevention of dementia. And we would do that. Some of the things that we can use would be meditation and diet. Mood, same things. You see these same things being used over and over again. But these are the things for which there is evidence. So let's talk quickly about supplements. We have plenty of evidence for vitamin D supplementation. Don't haphazardly take vitamin D. Ask your healthcare provider to check your vitamin D level and then make a recommendation based on that. And typically in multiple sclerosis, we like that level to be greater than 50. Many of you have been or are taking high-dose biotin. I would say that a couple of studies looked positive for potentially decreasing disability in people taking high-dose biotin. And then one study said that perhaps those results were not true and there was some harm found. So what does this mean? Well, high-dose biotin isn't available in the US. It's not. Trying to take it is prohibitive. So you have to take 30 tablets a day of 10,000 micrograms of biotin. And so this is a good example of waiting for adequate evidence. So a more recent study showed that there was an increase in the number of enhancing lesions in progressive MS patients who took high-dose biotin. Biotin can interfere with certain lab tests like thyroid function tests. So I would consider waiting to take high-dose biotin and instead get your biotin from foods. Like if you eat these things, eggs, dairy, almonds, whole grains, and healthy meats. Lipoic acid, there was a small trial in secondary progressive MS that showed lipoic acid or alpha lipoic acid at 1,200 milligrams per day lowered the annualized rate of whole brain atrophy at 96 weeks, which is about 2 years. So let's take a look at this. Again, small trial, no harm. There's been no second trial. So if I'm going through my algorithm, I'd say, well, alpha lipoic acid is fairly cheap. It's probably not going to hurt you. Again, I don't know that I would recommend it as a rule. Supplements in general are a dicey area. I have a harder time recommending supplements and providing you with really good evidence that they're going to help improve your multiple sclerosis. I have a much easier time recommending a healthful diet. And that's because supplements can have drug interactions. They don't necessarily have a lot of evidence. And there are certain supplements that you think may help you when they actually may cause your MS to be active, or depending on the disease-modifying therapy you're taking, could increase your risk for other issues. So you want to talk to your MS provider, and I would say also your primary care provider before you take any supplements. I'm going to cruise through these things that I think are really important. Spirituality. This is not religion. This is a sense of connectedness. It's a sense of an absolute immanent or transcendent power. It's a sense of hope. It's a sense of where you find your joy. It's that sense that you may not be able to define. The Joint Commission of Accreditation of Hospitals now requires a spiritual assessment of hospital patients. And in 2009, that National Survey of Complementary and Alternative Medicine showed that the most widely used alternative therapy was prayer. Mind-body medicine includes things like biofeedback, autogenics training, guided imagery, self-hypnosis, yoga, tai chi, and meditation. And we're now starting to have good evidence that mindfulness and relaxation are effective for stress, anxiety, and fatigue in multiple sclerosis. So that's really exciting. Why do we talk about mind-body medicine? I'm just going to show you quickly on this curve. Stress level, green is good, red is bad, right? But you can see how very easy you can go from green to red. And I'll use myself as an example. I am super motivated and super focused right now. I could stay up till 2 a.m. working because that's how excited I am. But if I do that for the next 3 nights in a row, guess who's going to be sick, in a really bad mood, tired, and not able to give anything next week? This girl. So you really have to look at mind-body medicine as a way to keep yourself healthy and functioning. Sleep, movement, nutrition, relationships, resiliency, spirituality, creating an environment to surround you that is calming, that is nurturing. These things are incredibly important. And finally, I'd say that an integrative medicine treatment plan in MS includes a comprehensive history with these components, a review of medication exposure, toxin exposure, supplement use, a review of significant and emotional and physical events. And this is what's different, perhaps, from a traditional medical evaluation, a physical exam, and development of a plan that's based on the most benefit, the least harm, the least cost, and your belief system. And that may include adjustment of medications, it may include supplements or botanicals, it may include laboratory evaluations, and then it may include referrals to appropriate providers that you think may be useful to you as recommended by that provider. And perhaps as importantly, it includes collaboration and communication with your other healthcare providers. So, do I have 20 more seconds? Can I have 20 seconds? Okay. So, I'm just going to teach you guys something real quick. Some of you may already know this, but you're going to have to chew your last bite because we're not choking tonight. And I'm just going to teach you the 4-7-8 breath. We're going to talk about it first, so you don't have to do anything right now. What you're going to do is you're going to exhale until you're empty. So take a breath, you exhale till you're empty. You're going to close your mouth and inhale through your nose to the count of 4. You're going to hold it for 7 seconds, and then you're going to open your mouth and exhale through your mouth to a count of 8. Okay, and I'm going to instruct you through this and count, and I won't let anyone get out of breath, I promise. Okay, so everybody just breathe in and then breathe out so that you empty out your breath. Close your mouth and inhale through your nose. 1, 2, 3, 4. Hold it. 3, 4, 5, 6, 7. Open your mouth, exhale. 2, 3, 4, 5, 6, 7, 8. Do it again. Took 20 seconds, right? That's mindfulness. You can do that at a red light. You can do that in line at Publix when things aren't going as fast as you want them to go. You can do that when your child's screaming, when your dog's barking, when your husband or wife won't be quiet. So that's what I offer you this evening. I want to thank you for your attention. That was a speeding train for me to talk about. And I wish you a life of wellness.
Awesome. Wow. So, thank you again, Megan. Who's got questions for Megan? Yes, I'm back in the audience here. I'm back helping out. And I need to see a show of hands, and I'll give you a nod, and I'll get to you eventually. Who want? Great. Thank you. I feel like I'm doing an auction.
What lab test does biotin interfere with?
The most common one is thyroid function, and so it depends on the lab company that's running the test and what assay they use to run the test. And you can usually prevent the interaction just by not taking the biotin for a couple days around your test.
Any questions back here? Come on, I need to see hands.
Question.
How about one of those weekends where
Turn
people?
around.
How about one of those weekends where people do the toxic release programs? Do you know anything about that?
Like the sweat lodges?
Something.
Okay, so no.
Did you say that medical marijuana can interfere with a disease-modifying medication?
No, I didn't say that. I said that CBD oil can still have psychotropic properties. So medical marijuana and CBD oil may interfere with some of your other medications that also have central nervous system side effects.
Speaking about medical marijuana, are there different strains that cause people to do different things, like be depressed or be angry or be just overly happy or laughing or eating or things like that?
So I'm definitely not a marijuana expert. It has not been my my realm of study. In general, there are two types of cannabis, and one is more activating and the other one is more sedating, cannabis sativa and cannabis indica. But any type of medical marijuana has the potential to cause those symptoms in a person.
Thank you.
Back to the high dose biotin.
Yes.
How many milligrams or whatever? What's considered high dose?
So what's considered high dose is 30 times 10,000, which is 300,000 micrograms, which is, I think, somebody do the math on that for me. 300,000, 1, 2, 3, 300 milligrams a day of biotin, I think, is what's considered high dose.
Okay, all right. And also, if an integrative medicine practitioner feels that nutrition should be improved, do you refer to a nutritionist, and does insurance cover that in general, or?
Yeah, so I would say it depends on the level of nutritional counseling that's required, which would depend on the medical history, but many times a physician or an NP or PA would refer to a nutritionist or a licensed dietitian. I am not sure of the insurance coverage on that from commercial to Medicare, but most insurance companies will cover something. The problem is sometimes it's just, it's like only for diabetes. You know, you have to have an appropriate diagnosis for it to get covered. Yeah, I would say referrals to nutritionists and health coaches are pretty prevalent in this world, yeah.
You talked about the...
Wait, start again.
Sorry.
Start again.
You talked about the importance of sleep.
Yes.
Now, do you, just your personal opinion, do you think that the prescriptive drug aids, the sleeping aids, give you the right type of sleep?
My personal opinion is that they do not. Okay. Sleep aids like hypnotics, like Zolpidem, can interfere with your ability to achieve REM sleep, and so can antidepressants, which are often necessary for a person, and then some of the sedating older antidepressants like dizipramine, imipramine, amitriptyline, things of tricyclic antidepressants that we use to help people sleep can also interfere with other things or cause other problems with long-term use. So I think that they are useful to help a person who's kind of stuck in that really bad situation of insomnia, but I think that the ultimate goal should be to try to learn how to sleep on your own.
Any recommendations for how to do that?
Yeah, so, a comprehensive sleep plan would probably include cognitive behavioral therapy, melatonin, if there's no reason that you shouldn't take it. Melatonin can be very helpful. Magnesium can be very helpful in lower doses so it doesn't cause diarrhea. Chamomile tea sounds like what your grandmother told you, but it works. Establishing a bedtime routine that's calming, like you're in the bedroom for sleep and sex, that's it. No TV, no electronics. If you're reading, read a book that, don't be reading like the murder mystery, read a calming book. Creating a ritual around bedtime. oftentimes people will recommend having a cup of tea. I say base that on what your bladder does at night because you don't want your sleep to be disturbed by getting up all night. But maybe doing some stretching exercises or some deep breathing or listening to a guided meditation or guided imagery, or maybe you have a spiritual practice or a devotional and you could read that at night, or journaling, that sort of thing. Creating like a calming atmosphere to help kind of lull you. And think of, I mean, I'm in the middle of babyland, so I think of what we do with my child every night. We take a warm bath and then we love on him, and then we read 3 books, and the lights are down low. And, you know, if we all had that if I had that hour and a half back, oh my gosh, every night. But if we all had the time to do that for ourselves, right? So we have to think of it in a way that we can do it for ourselves. And it takes time. The unfortunate thing about sleep is it only takes a few nights to get you into that like behavioral stick of insomnia, because then you start to fear sleep. Like, oh my God, am I gonna be able to do this tonight? I couldn't fall asleep last night. Am I gonna be able to do this? Like, that happens so fast. And then getting out of it takes longer.
Thank you.
Sure.
That's awesome. Thank you.
Next question.
Oh, actually, I don't have MS. I have something else on my brain, a pineal cyst or tumor. Where are you? There you are. So I just wanted to say that a lot of things that you talked about are things that my neurologist and my primary care doctor and I have talked about, but I took a lot of good notes, and I agree with a lot of things that you said, and they were very helpful. Thank you.
Thank you. Yeah, thanks for your comment. I appreciate it.
Thank you. Anybody on that side of the room? Come on, we're needing some questions over here. I feel lopsided. Come on, anybody? Do you know it all? Okay, great.
I've got a full mouth.
I'll let you pass.
How old is your boy now? I see him. Saw the picture.
He's almost 2.
2.
He's about a month and a half away from being 2.
Questions.
I would agree with this lady's comment over here. This has been fascinating, and I did not take good notes. So I'm hoping that at some point for friends we can get copies of the
The good news is we are video recording. The better news is that in a few weeks it's going to be on the MS Views and News Learning channel. Okay? And so when we publish that, you will all get an email, another one from me, okay, that tells you that it is now published and you can look at it. All right? And it's there forever. Thank you. All right, anybody else? Again, this side of the room. This side is weak.
So Megan, is there information if someone wants to come and consult with you?
Thanks, Joni, for asking. So I've recently embarked on my own new professional adventure, and I'm starting, or I have started, an integrative medicine practice that focuses on neurology and MS, and I can see people starting next week. I can see people who have Medicare starting April 1. Information about the practice can be found most easily on Facebook, if you are on Facebook, and the page is First Coast Integrative Medicine. The website is www.firstcoastintegrativemedicine.com, and right now that will take you to GoDaddy because my website won't be ready for a few weeks. So if you have questions, please visit the Facebook page or email me at Megan, megan.weigel, Weigel, at firstcoastintegrativemedicine.com. And I'm happy to help. And if I can't see you, I'm happy to steer you in the right direction. So
let's give Megan a round of applause. Fabulous. Please remember that you were at today an MS Views and News program. We sponsored this event for you. We did not want to wait to get a grant. We knew it was January. We do events like every year. We do it somewhere in Jacksonville. So we wanted to make sure that we got this for you. And so I just want to thank you all for being here today.